Hello, everyone. So here we have a poster showing the highlights for our presentation entitled Understanding and Enhancing Prostate Cancer Screening Rates Among Older African American Men. So first we can see that the USPSTF advises case-by-case evaluation of PSA screening for men ages 55 to 69. Our population is African American men because they are particularly high risk for prostate cancer. In fact, as you can see in section 2, a higher proportion of African American men develop prostate cancer in comparison to other ethnic groups, and they also have a lower 10-year survival rate. Moving down to adherence, the adherence to recommendations are greatly impacted by difficulty contacting patients, insurance incompatibility, and lack of follow-up by physicians. COVID-19 also had an impact, as prostate cancer screenings were postponed due to restrictions from limiting COVID-19 from spreading. Moving over to the right side, PSA testing is controversial because of its low sensitivity/specificity in detecting prostate cancer. This causes increased morbidity and mortality from complications associated with overdiagnosis and overtreatment. Among prostate cancer screening guidelines, the ACS, USPSTF, and AUA encourage shared decision-making. However, there are differences in how they define levels of risk and the age at which screening should start. Now, let's talk about the risks and limitations. Men who go through PSA screenings and test positive are at an early risk of death due to overdiagnosis. There are higher chances of false positives, which can lead to needle biopsies that can cause an individual anxiety and pain. In regards to structural level implications to enhance screening, this year the Screening for HIM Act is calling to waive cost-sharing requirements, and it's making its way to Congress to create easier access for high-risk groups, including African American men. Now, looking at the bottom middle of the page, the health belief model can be used to explain the risk factors that influence non-adherence in PSA screenings. Risk factors for older African American men include a high rate of low perceived susceptibility to the disease itself, belief that the cure is worse than the actual disease, lack of transportation, and lack of insurance. However, we can address these risk factors by enhancing their perceived benefits, cues to action, and self-efficacy. Moving up to teaching and learning implications, the use of shared decision-making and teachback can enhance prostate cancer screenings by emphasizing the patient's values, culture, and identifying knowledge gaps regarding prostate cancer screening. With all that said, let's end off by talking about our culturally tailored CNL strategy for addressing the problem. With the use of a community-focused framework and culturally tailored education materials that are deemed effective in research for targeting minority populations, we will be partnering with UCLA Health and the LA Lakers to host a prostate cancer awareness event that will offer front row tickets to African American men ages 55 to 69 who complete an entire prostate antigen screening series. Thank you.